Hi, my name is Dr. Kate Hayner. I'm an occupational therapist and I work at Samuel Merritt University. I am going to demonstrate the California tri-pole taping method. This is a technique that I developed to use on somebody that is subluxed, often from a stroke, and it is something that I've also conducted some research on and published on. So if you're interested in some of that data, you can look for my article by Googling Kate Hayner and the California tri-pole taping method. You should pull up my article. It's an open access article, so it's open to anybody. Okay, one of the first things that you need to understand when you're going to work with somebody on taping for the California tri-pole taping method is to reduce subluxation is when a person, and Kyle here does not have a subluxed arm, so I'm really going to take the head of his humerus that sits in the glenoid fossa, and I'm going to actually pull it up. So it's going to feel very tight for him. But when somebody is subluxed, especially inferiorly, then this tape will help approximate the head of the humerus back into the glenoid fossa. So in order to assist with that approximating into the glenoid fossa, you want to rest their arm on a supporting surface while you're taping. The other thing that you want to do is understand some of the bony landmarks. One is the deltoid tuberosity, which is about halfway down the humeral bone, and we drop the tape 1 inch below that. Another is the coracoid process, and it's if you come up here, it's in this, you don't have to move here. It's right, this bony area right in here, in the anterior part of the shoulder. We also have the acromial process, which is this prominent area, and then the spine of the scapula, which is generally, you can just see the spine of the scapula comes out here. So I have those landmarks as I'm going to bring that tape up and around the arm onto those landmarks. Okay, so the technique that I'm going to demonstrate for the tri-pole taping method requires both the rigid strapping tape and the undercover roll. This has a sticky back. It has no stretch to it. It's not kinesio tape. And what I'm going to do is measure 3 pieces of tape. One is the medial component, and we're going to go 1 inch below the deltoid tuberosity, which would be about here. So we're going to drop it down to about there. Another piece of tape comes from the spine of the scapula back here to, again, the deltoid 1 inch below the deltoid tuberosity, and it's going to be wrapped around. So we're just eyeballing how much tape we're going to use. And another piece is going to be wrapped around the front, right here. I've pre-cut some pieces of tape here, and we will start with, the first thing we want to do is actually wipe this area down in case somebody has any kind of lotions on. You'd want to wash that away. If somebody has a lot of hair on their arms, I sometimes ask them to, or I will shave their arm, because when the tape is removed, it can pull that and be painful. This is called a skin barrier wipe. Protects the skin. It also helps for the adherence of the tape to the skin. This is a cloth protective tape. Is simply to protect the skin before I put the rigid strapping tape on. Okay, so the first piece I'm going to put in is an inch below the deltoid tuberosity and up here. Just simply putting it on gently. I have a little bit too much here. other piece is going to come wrap around, and I will show the camera that in just a minute when I finish putting that on. And this third piece of tape goes into the anterior portion of the shoulder. Again, from the same landmark down below and up around the shoulder. Here. So just placed on. This part where we actually add the rigid strapping tape, leave it onto the roll because it's much easier to put it on that way. But take off as much as you think that you're going to use. And you start by anchoring it. And I'm going to start by doing the middle part. So I'm going to anchor it down here on top of the cloth tape. And then I'm going to pull up, and you should see a lot of wrinkling, and we'll do this close up also. For somebody that does not have a subluxation like Kyle, it's going to feel like I'm really jamming the head of the humerus into the glenoid fossa. But for somebody where there is a subluxation, they often say that it feels like somebody's holding their arm in place. And the posterior part. Bring that up. If somebody is uncomfortable after I put this on, I will sometimes lift the tape up and release it a little bit because it should never be uncomfortable when it's finished. Okay, now I'm going to actually zoom that camera in so that you can see the So there should be some buckling and wrinkling of the tape here. And then the last thing, to keep these parts from rolling, I put an added piece of tape, and this is simply just to keep that tape adhered to the skin. Okay, so that's the final product, and I'm just going to have Kyle come over here and drop your arm down. Probably feels like he's a little bit elevated. Somebody that is subluxed, their arm will often be in the same position and quite equal to their other arm. Can you put that down for a minute? Just feel quite tight. And usually there's a pulling right here. Okay, so if this is uncomfortable on somebody, you can always take this up. Just remove that a little bit, and I'm just gonna, and then I bring it down a little bit just to let it up. Want to put it back there?